Welcome to the SourcePoint presentation of Introduction to Medicare. In this video, you will learn what Medicare is, the different Medicare options, when to enroll, and costs. Let's get started. Medicare is our federal health insurance program, administered by the Centers for Medicare and Medicaid Services. It covers those who are 65 and older, those of any age who are disabled after being on Social Security disability for 24 months, and those diagnosed with end-stage renal disease, also known as permanent kidney failure, or those with ALS, also known as Lou Gehrig's disease. Here are 5 helpful facts about Medicare. 1. Medicare should not be confused with Medicaid, a state and local assistance program for low-income individuals. 2. Medicare should not be confused with the Social Security Administration, which administers disability and retirement benefits and handles enrollment in Medicare Parts A and B on behalf of Medicare. 3. The Marketplace exchange does not affect your Medicare coverage. Your Medicare benefits have not changed due to changes to the Marketplace plans, also known as Obamacare. 4. It is illegal for anyone who knows you have Medicare to sell you a Marketplace plan. And 5. The Medicare open enrollment period, which runs each year from October 15th through December 7th, is a time when there's a higher risk of fraudulent activity. So please don't share your Medicare number or other personal information with anyone who calls you or knocks on your door uninvited. Medicare works anywhere in the U.S. or U.S. territories with any provider who accepts Medicare. Referrals are not required, and there is no network. Once you are eligible for Medicare, there are 2 options to consider. Option 1 is known as Traditional or Original Medicare. Option 1 has 3 components. You will keep your original Medicare Parts A and B, plus you can purchase a Medicare supplement plan to cover costs not covered by Medicare. The third component is a Part D drug plan. You will have 3 insurance cards and 3 separate premiums with Option 1. Option 1 has a higher monthly cost, but little out-of-pocket cost for services. It does not cover routine dental, routine vision, or hearing aids and services. You can learn more about Medicare supplement plans and Part D plans by watching our Part 2 presentation. Option 2 is known as Medicare Advantage plans, Medicare Part C plans, and Medicare replacement policies. These plans are offered by private insurance companies that contract directly with Medicare to provide all your Medicare coverage through a single company. Examples of such companies include AARP, Aetna, Anthem, CareSource, Humana, and Medical Mutual. Advantage plans offer the same coverage as original Medicare but handle payments differently. You might be responsible for copays, co-insurance, and deductibles for specific services. These costs contribute to the plan's annual out-of-pocket maximum. Many Advantage plans also include routine vision, dental, and hearing aid coverage, with the option to buy more extensive plans for an extra monthly fee. There are 2 types of Medicare Advantage plans: HMO and PPO. An HMO, or Health Maintenance Organization, operates in your local area, including Columbus and its metropolitan area. HMO plans require you to use in-network providers, otherwise, you may be liable for the full billed amount. The only exception is when you go to an emergency room or urgent care anywhere in the U.S. or U.S. territories. Then you're covered at in-network benefits, just like at home. Most HMO plans also require referrals to in-network specialists. A PPO, which stands for Preferred Provider Organization, offers both in-network and out-of-network benefits. If you stay in the network, you receive the highest level of benefits. PPO plans also allow you to see providers outside the network, however, out-of-pocket costs will be much higher. Keep in mind that many PPO plans pay only 50%. Additionally, you may have a deductible to meet and a much higher out-of-pocket maximum per calendar year. Be aware that out-of-network providers aren't obligated to accept your plan, and you may need to pay full charges up front. Always verify with the provider if they accept and bill out-of-network plans. Let's compare the 2 plans. Regardless of which option you select, Option 1 or Option 2, everyone must pay the Medicare Part B premium. With Option 1, your monthly premiums are typically lower, but you may face much higher out-of-pocket costs. With Option 2, you may have a monthly plan premium in addition to the Part B premium. Please note that Medi-Gold plans require you to use Mount Carmel providers and hospitals. This includes St. Anne's, Mount Carmel East, and Mount Carmel West. Medi-Gold plans are not accepted at Ohio Health, OSU hospitals, or their providers, unless in a true emergency. You can learn more about Medicare Advantage plans by watching our Part 3 presentation. Now let's talk about applying for Medicare. If you started receiving Social Security or Railroad retirement benefits before age 65, you will automatically be enrolled in Medicare Part A and Part B. In these cases, your Medicare Red, White, and Blue card will be mailed to you about 2 to 3 months before your 65th birthday month. However, if you are not receiving Social Security or Railroad retirement benefits, you will need to enroll during your initial enrollment period, also referred to as your IEP. The IEP is a 7-month period, broken down as follows. The 3 months before your 65th birthday month, the month of your 65th birthday, and the 3 months after your 65th birthday month. If you want your benefits to start the first day of the month that you turn 65, you should enroll in Medicare A and B, plus your Medicare plans, 1 to 3 months before your 65th birthday month. Medicare will always begin on the first day of the month when you turn 65, unless your birthday is the first of the month. In that case, your Medicare coverage will start on the first of the prior month. If you do not enroll in Medicare within 3 months before your birthday, your Medicare will start the first day of the month after you enroll. If you miss your 7-month initial enrollment period altogether, you will need to wait until the annual general enrollment period, which runs from January 1st through March 31st. In this case, your coverage will start on the first day of the month after you enroll. You will also incur a 10% late enrollment penalty for each year that you were eligible. This fee will be added to your monthly Part B premium. The penalty amount increases each year and stays with you for life. If you're covered under your or your spouse's current employer group health plan, you may delay enrolling in Medicare Part B without penalty. You will have a special open enrollment period when you retire or lose employer coverage for any reason. This is an example of what your Medicare Red, White, and Blue card will look like. It displays your name, 11-digit Medicare number, and the effective dates for Part A and Part B. Keep in mind, your Part A and Part B dates might differ, depending on when you enrolled. So, what do Medicare Parts A and B cover? Part A covers inpatient hospital stays, including room and board charges when you are admitted. It also pays for skilled nursing facility costs after at least 3 inpatient nights. Additionally, Part A covers home health care and hospice services. Part B covers most other medical services, excluding prescription drugs, which will be explained in the second presentation. Part B includes doctor visits, testing, outpatient services such as preventive care, surgeries, therapies, urgent care, durable medical equipment, and emergency or hospital visits that do not result in admission. Remember, Medicare was never intended to cover 100% of healthcare costs. With over 65 million Americans enrolled, the government cannot fully pay all expenses. On average, Medicare covers about 80% of the approved costs after you meet the Part B deductible. You are responsible for the remaining 20% plus the deductible. Medicare does not cover services that are cosmetic, experimental, investigational, or unproven unless medically necessary. It also generally does not cover care outside the U.S. Durable medical equipment, prosthetics, orthotics, and supplies must be obtained from a Medicare-approved supplier. To find local providers, visit Medicare.gov or call 1-800-MEDICARE. This slide lists the Medicare preventative benefits that are covered. Medicare Part B deductible and co-insurance are waived for most preventive care services. Please note that not all services listed are payable every year. To keep track of your eligibility for each covered benefit, consider setting up an account on Medicare.gov. This account will also display the status of any claims processed by Medicare. Since Medicare only sends out benefit summary notices every 3 months, you can see claims as soon as they are processed. Let's dive into the costs associated with Medicare, keeping in mind that these amounts are subject to change every year. Regarding premiums and credits, Medicare Part A is free if you've worked in a job that contributed to Social Security for at least 10 years and earned 40 credits. If you have 30 to 39 credits, a monthly Part A premium applies. For those with 30 or fewer credits, a higher monthly premium applies. These amounts can change each year. If you don't have 40 credits, you can still get Part A for free through a spouse who has earned the necessary 40 credits. For Part A, you're responsible for a hospital deductible for each benefit period. This period begins on the day you're admitted and ends once you've been out of the hospital for more than 60 days. If you're discharged and then readmitted after a gap of 60 days, a new benefit period begins, and you'll have to pay the deductible again. The deductible remains the same whether you stay in the hospital for just 1 day or up to 60 consecutive days. For example, if you're admitted for a week, you'll need to pay the Part A deductible. But if you're discharged and then readmitted within 60 days, you won't have to pay another deductible, even if the medical condition is different. However, if you're readmitted after more than 60 days, a new deductible will apply. There's no limit to the number of benefit periods you can have in a calendar year. The Part A deductible covers the initial 60 days of a benefit period. If your stay extends beyond this, you will face a separate daily copay for days 61 through 90. For days 91 through 150, a higher copay applies under lifetime reserve days. If you require skilled nursing care for rehabilitation after staying at least 3 nights in the hospital, the first 20 days are fully covered under the hospital deductible you have already paid. For stays exceeding 20 days, a daily copay will be charged for days 21 to 100 within the same benefit period. After 100 days, you'll need to pay out of pocket if you remain in that benefit period. In Part B, you'll pay a monthly premium that may change each year. If your income is higher, your costs for Parts B and D will increase. More details on this will be provided in the next 2 slides. Enrolling late in Medicare Part B could lead to a 10% annual penalty added to your premiums. Part B services have an annual deductible that may change annually. Once you've met this deductible, Medicare covers 80% of the approved amount, and you pay the remaining 20%. Lab charges are typically covered at 100% and don't count toward the deductible. However, fees for lab draws or venipuncture may be subject to the deductible. Here you can see the Part B premiums for those with higher incomes. Premiums are based on monthly adjusted gross income from tax returns filed 2 years earlier. The Social Security Administration reviews these returns annually to determine your premiums. Your premium amount may change if your income changes. Higher incomes incur an additional charge called the income-related monthly adjustment amount. Individuals with incomes below the listed amounts will pay the standard Part B premium, which can change each year. Here you can see the additional monthly premium that will be added to your monthly Part D plan. This is calculated the same way as your Part B premium, as previously discussed. Individuals with income below the amounts listed will pay the standard Part D premium, which is subject to change each year. This slide illustrates the difference between an HSA, or health savings account, and an HRA, or health reimbursement account. Both accounts can be used to cover Medicare premiums, as well as copays, coinsurance, deductibles, and expenses for dental, vision, and hearing services. It is important to note the last item listed under HSA. If you are contributing to an HSA, it is necessary to stop making contributions to your HSA account at least 6 months before enrolling in Medicare. Failing to do so may result in a 6% tax penalty. It is advisable to consult your certified public accountant or financial planner to understand how this may affect your specific situation. This concludes the Introduction to Medicare presentation. We hope you found it helpful in understanding Medicare and your options, and that it answered some of your Medicare questions. To get a complete picture of Medicare, we invite you to watch our next 2 videos, Medicare Supplements and Part D Plans and Medicare Advantage Plans. For more learning opportunities, feel free to register for an in-person Medicare class at SourcePoint or off-site throughout Delaware County. You can find our upcoming classes, dates, and times online at mysourcepoint.org/insurance.